Hello, my name is Crystal Zamora. I'm a UTEP College of Nursing graduate student. Today I have Alvin for my head, eyes, ears, nose, and throat exam. Alvin, is it okay if we use you for this exam?
Yes.
Okay. I'm going to be doing a head, eyes, ears, nose, and throat exam on you to assess any changes or just to check how your health is in those areas, followed by a mental health exam, which is a mini cognitive test. So I'm going to begin by looking at your hair distribution. His hair is equally distributed throughout his head. I'm looking at your scalp. I'm noting any scaliness, any dryness, which he does not have. It appears normal. Is it okay if I touch your head to look at your scalp?
Yes.
Okay. So it looks good on all sides. I'm looking at your skull. I'm noting that your skull is round throughout. There's no abnormalities. I'm going to feel for depressions, any lumps, lesions, which he does not have. His scalp is, his skull is normal cephalic, and it is, there's no trauma to it. Next, Alvin, I'm going to be looking at your face. So I'm looking at the symmetry in your face, the shape, any abnormal facial movements or involuntary facial movements, which he does not have. His face is symmetrical. And next, Alvin, I'm going to be checking your lymph nodes. So I'm going to go from behind, and you're just going to feel my hands. I'm feeling both of the occipital and then the preauricular behind his ear. The postauricular behind his ear, preauricular in front of his ear, and then I'm going to come in front of you, and I'm going to feel for your tonsillar lymph nodes, your submandibular lymph nodes, your submental lymph nodes, and then I'm feeling for your superficial cervical on both sides, and I'm going to feel for your deep cervical, which could be difficult to feel, so I'm going to have you turn towards your left side. Okay, and now turn to your right. Good, so I feel them. I don't feel them, they're normal size. Now I'm gonna have you look at me, and I'm gonna feel your inferior cervical lymph nodes. And then lastly, I'm gonna feel your supraclavicular lymph nodes, which are above your collarbone. Okay. And then your infraclavicular under here. Good. So I did not feel any of his lymph nodes, which means they were not swollen, which could be an infection. Your lymph nodes are mobile, less than a centimeter, and they're soft. And did you feel any tenderness with any of the lymph nodes? No? Okay, so they are non-tender. Next, I'm going to be looking at your trachea. I'm going to check that it is in the middle of your neck, no deviations, so it's in a normal spot. I'm going to be also feeling your thyroid gland from behind. You could just stay where you are. I'm feeling below the cartilage, the cricoid cartilage. So Alvin, if I could just have you swallow. I don't feel any enlargement, no nodules. His thyroid feels normal. Now I'm going to look at it from the front and also palpate, okay? So if you could just swallow again. Okay, so his cricoid rises, his thyroid is normal, no nodules noted, no inflammation. Okay, Alvin, I'm done with your head portion of your assessment. Next, we're going to move on to the eyes. So I'm going to start off by doing a vision check, which is used with the Snellen chart. So you'll see a chart behind here. If I could have you stand on this circle. And I'm going to have you read me the 2020 line, which is the lowest one. If I could have you read me the letters, please.
L T F P H.
Okay, so Alvin did read these lines correctly, which means that his vision is 20/20. That means that he could read at 20 feet what the population could read at 20 feet. So Alvin, let me have you take a seat again. Next, I'm going to be checking your visual acuity. I'm going to check your pupillary accommodation, confrontation. So we'll start off with looking at your eyes. I'm looking for any trauma in your eyes, any foreign bodies, any specks. both eyes. I'm looking at your cornea, your iris, and your lens, which all appear good. There's no trauma or lesions, no foreign bodies. And it looks the same on your other eye, so good. Now I'm checking for your pupillary reaction to direct and consensual light. So I'm pointing the light at your left eye, your left pupil constricts, pointing the light at your left eye again, and your right pupil constricts. Now I'm pointing the light at your right eye, your right pupil constricts, pointing the light at your right eye, and your left pupil constricts. So your pupils are equal, round, reactive to light, and I note that your pupils are at 3 millimeters, which is normal. Next, I'm going to be checking for consensual light, confrontational reaction, which is your peripheral vision. So let me know whenever you see my fingers. You could just look at my nose. Let me know when
Now.
okay.
Now. Now.
His peripheral vision is intact. Next, I'm going to be checking your 6 cardinal fields of gaze, which is to check your extraocular movements. So look at my finger, follow it. And I'm checking for nystagmus, any rapid eye movements, which we'll finish this. And he does not have nystagmus. Now I'm going to check for accommodation. So this means I'm going to point my finger. You're going to look at my finger and follow it. We're checking that his eyes are moving equally on both sides. There's no deviations. And now I'm also going to check that the pupil will become dilated as I move further out and then constricted as I move forward in. Good. So his accommodation is good. Next, I'm going to be doing a red eye test. Or actually, Alvin, let me look at your eyes. I'm going to look for any crusting of your eyebrows and eyelids, any eyelashes. I'm also going to check the lacrimal apparatus right here for any swelling. And then I'm noting that you don't have any excess tears or dryness in your eyes. And your eyes are nice and moist. I'm also going to have you pull down your eyes so I could check the sclera and conjunctiva. The conjunctiva is nice and pink, moist, intact, no edema, erythema. And I'm looking, you could put them back up. Your sclera is nice and white, intact, there's no hemorrhages. Next, Evan, I'm going to do the red eye test, okay? So I'm going to point the light into your eye. I'm sorry, I need to switch my equipment so that I have the ophthalmoscope to do my red eye test. And I'm turning on the light. And I'm moving the dial so that it's at -1. And I'm going to start from far away, and then I'm going to move the light into your pupil. What I'm doing with this, I'm looking at your optic disc, your optic vessels, your retinal vessels, and your retina. So I'm going to move in, kind of angular. Okay, and his retina optic disc is nice pink, orangey yellowish. I see his retinal vessels, and there appears to be no lesions or hemorrhages in there. Next, I'm going to be looking at your other eye, okay? So same thing, just look straight forward. And I'm going to move in, I'm pointing it at his pupil. Inside his pupil, I could see the optic disc, the retina, and good. I'm noting that the optic canal is at 0.3 on both eyes. I didn't notice any damage inside the retina. And Alvin, that concludes the eye test. Next, I'm going to move to your ears. I'm going to switch my equipment back into an otoscope because this exam will require me to look at your ears. But first, I'm going to feel, touch, see them. So I'm going to look at your auricles. The skin on your ears are intact on both ears. There's no redness, swelling. I'm going to feel now. Let me know if they're tender.
No.
No? Okay, there appears to be no lumps or lesions. on both ears. Any tenderness on this ear?
No.
Okay. So next I'm going to look inside of your ear. I'm going to be pulling the auricle back and upward. Since you're an adult, if you were a child, I would pull it down and back. So what I'm looking inside your ear, I'm looking at your tympanic membrane, and your tympanic membrane is nice on a pearly gray. And then I'm looking at your malleus. It's shiny and it's at the 5 o'clock position on your right ear. I'm also looking that you don't have any drainage, no cerumen, which you don't have any of that, no foreign bodies in there, so that's good. I'm going to do the same on your left ear. I'm going to pull it up and back. Okay, I'm not noting any cerumen, no drainage, no discharge, and no trauma. Your tympanic membrane is nice pearly gray, intact, and your malleus is positioned on the 7 o'clock on the left ear. Okay, so that concludes me looking and inspecting your ears, but I'm going to be doing a hearing test for gross hearing. So I'm going to do a whisper test. I'm going to cover your left ear and whisper a word into your right ear, and then you're going to repeat the word, okay? So, cow.
Cow.
Okay. Now I'm going to do the same on your other ear. Hello.
Hello.
Okay. So Alvin was able to repeat the correct words. He passed the hearing test. Alvin, have you had any hearing loss lately?
I don't think so.
No? Okay. So either way, I'm going to be doing the Weber test on you. This will check for any unilateral hearing loss. I'm going to strike my tuning fork and place it on your forehead. You're going to hear and feel vibrations on, and then when you don't hear the vibrations, let me know. And then we're going to see what ear you heard it on. Ready?
Yes. Stop.
Okay. What ear did you hear the vibrations on?
Both, but biased to my left ear.
Okay. So he did pass the Weber test. Next, I'm still going to do the RIN test. This RIN test is to check for conductive hearing loss. So I'm going to put the tuning fork on your mandibular process, the bone behind your ear. And then you're going to tell me when you stop hearing and feeling the vibration. And then I'm going to switch it to in front of your tragus, and you're going to tell me the same when you stop hearing it, okay?
Stop.
Are you
Stop.
still? Okay. Okay, next I'm going to do the same on his left ear. Strike the fork. Tell me when you don't hear it.
Stop. Stop.
Okay, so the RIN test, his hearing is intact on both, so that means air conduction is greater than bone conduction for this test. And Alvin, that's all for your ear exam. Next, we're moving on to the nose. So your nose, I'm going to be looking with a light, but first I'm going to look at your nose here. I'm looking at the anterior and inferior nose. There's no lesions, no masses or bumps, no acne on your nose. I'm going to look inside of your nose, so I'm going to turn on my light. I'm going to stick it in. I'm looking for any polyps, ulcers, which I don't know. Your nasal mucosa is nice and pink intact. Nice and pink intact on both sides. There does appear to be some hair inside his nose, which is completely normal. And I'm also going to be looking for any polyps. I'm looking for the sinuses to not be swollen. I'm looking at his nasal septum. And there appears to be no ulcer swelling, no issues inside your nose, no discharge. Next, Alvin, I'm going to be looking at your mouth, okay? So if you could just smile at me. His smile's nice and symmetrical. His lips are nice and pink. They're not cracked. They're nice and moist. They're not too dry or too wet. Now, Alvin, I'm going to look inside of your mouth. I'm going to start off by looking at your teeth. So if you could just show me your teeth, give me a smile. Good. Now open your mouth. Your teeth are nice and white. They're not yellow. Your teeth they're aligned. There's no missing teeth. So good. Your teeth are good. Now I'm looking at the oral mucosa. Nice and pink, intact. There seems to be no lumps or masses. Alvin, if I could have you pull your bottom lip down. I'm checking your gingiva. So that's kind of like your gums. They're intact, no erythema, no lesions, no ulcers. Now let me see the top one. So if you could lift your top one up. Intact, moist, no ulcers or lesions. So good. They're not swollen. Now, Alvin, I'm going to look at your tongue. So if you could just stick out your tongue for me. Stick it out. Good. It's nice and pink, intact. There seems to be no lumps, but I'm going to be feeling it. Let me feel your tongue. You could stick it back in. I'm placing my gloves so I don't touch his tongue with my dirty hand. So let me touch your tongue, Alvin. I'm feeling for any lumps, which I don't feel. I don't feel any. Checking his cheeks now that I'm inside. And if you could lift your tongue up, checking for the mandibular glands, which are not swollen. Good. I'll just remove my gloves now. And now I've checked your teeth, your oral mucosa, your gingiva, but I need to look at the back of your throat. So try to open your mouth wide, stick your tongue out, and say, ah. Okay, so I see his uvula. It's intact. I see his hard palate. I see his soft palate. His tonsils are not swollen. I see the back of his pharynx. I don't see any white specks. It's nice and pink and no redness or erythema, which could be a cause of infection. And then, Alvin, I'm going to have you open your mouth again and say, ah, and I'm going to check that the uvula is going up while the tonsils are moving side to side. Good. So his pharynx, his tonsils are intact. And Alvin, that concludes my mouth assessment. So what I'm going to do next is a mental health exam. This is called the mini cognitive test, and it's testing for dementia, which is something we check for every patient. Have you had any trouble with memory lately? No? Okay. So what I'm going to do is I'm going to have you, I'm going to tell you 3 words, and you're just going to repeat them whenever I tell you them. So the 3 words are sunrise, chair, and banana. So I'm going to have you repeat those words.
Sunrise, chair, and banana.
Good. Okay, Alvin. So now I'm going to have you draw a clock for me. I want you to write in the numbers, and then I'm going to have you draw the hands at 10 past 11 o'clock, okay? So I could have you do that.
And you said 10 past 11?
Yes, 10 past 11. Past 11. So as you could see here, Alvin did draw the clock correctly. He placed all the numbers in the correct position and the hands as well. So Alvin, now that you drew the clock, tell me, what were the 3 words that I told you earlier?
Banana, sunrise, and chair.
Okay, perfect. So Alvin drew the clock correctly, which gives him 2 points, and he stated the 3 words correctly at the end, which gives him 3 points. So his total is a 5, which means that he does not have any evidence of memory loss or dementia at this time. So, Alvin, I want to thank you so much for letting me do this assessment and for taking the time to be with me here today. That concludes my head, eyes, ears, nose, and throat exam, as well as my mental health exam. And this concludes my presentation. Thank you.